Welcome back to the program. I'm Desley Humphrey. Until fairly recently, patients in the Middle East had to travel outside the region to get quality health care. Now, with money being pumped into private hospitals and clinics, Gulf nations are pushing to become world leaders in the sector. But with limited legislation for these big investments, is that what's holding the industry back? That's a question I put to a panel of experts in the latest of our series of summer debates.
It's extremely patchy. I mean, the UAE clearly has been in the forefront of building up that conducive environment by putting proper regulation in place. I mean, look at this hospital, for example, here in Dubai. You would not find this type of quality in many countries, also in the GCC, because of the difficulty of investing properly. There are countries, my home country, Kuwait, where we still have a regulatory framework which is very old, very cumbersome, very difficult. And, you know, waiting 9 months, for example, to get a building permit to change a floor on a hospital, investors don't have the time for that and to wait for that.
And uncertainty isn't what investors want.
I think for us, if you look at it, the time to market to enter a new market, if the intention is there, but the time to market is many, many years, you know, as private equity, at least we are patient capital, but we want the capital to work. And then we're patient. But for us to wait until the capital starts working, that's not really how we operate.
What about the financing, the backers? Where is the money coming from? We've seen a number of UAE healthcare providers look overseas for UK listings to raise funds. Is there a problem with getting access to funds in the region?
There is no issue regarding funding for healthcare. You have plenty of people running behind you, be it banks, be it private equity firms, for healthcare, because it's considered to be a sunshine sector, even during this very bad period world over, and even in Middle East in the last few years, when everything was going down. Healthcare was one area which was actually growing.
So where do you see the opportunities?
I think in the MENA region, opportunity-wise, one of the attractive sectors is in the diagnostic sector, which we're already invested in, especially in populous countries, because if you look at the average test per patient in, let's say, in Egypt or across MENA generally, you're looking at 2.5 to 3 tests per patient. In the UK, it's 22. And the reason is that in a country like Egypt, generally speaking, the doctors prescribe first, and then if it doesn't work, they tell them to go do a test. Whereas in NHS in UK, there's a lot more testing, and then there's prescription. And I think just on the regulatory point, the one regulatory hurdle which is present in some countries, which actually prohibits in investing really, is the regulatory hurdle which has a blocking on ability to scale up your business, i.e. starting with one clinic and being able to have a chain of clinics, or starting with one lab and having a chain of labs. And one of the countries which have an issue around that are the Maghreb countries. So whether it's Tunisia, Algeria, or Morocco, the regulatory framework there currently, to a large extent, it's patchy, but to a large extent, doesn't really allow the creation of scale plays. And that's changing, and it will take time to change. But I think the key thing about healthcare is being able to scale up your business to be able to leverage your cost base.
I mean, it's a similar situation in Kuwait, for example. For each pharmacy that you have, you require a pharmacist license in order to have that license. My vision would be, for example, of a proper streamlining of GCC regulation and alignment of regulation. And I think you would see businesses like Abraaj or Dr. Moopen's business really grow quickly in places where they're not going to.
So an umbrella regulation across the GCC is something that you'd like to see?
That would be beautiful. That would be beautiful.
Well, let's switch gears a bit and talk about skills and jobs and just how serious this situation is for the region. We've got calls and lofty goals from all sorts of nations around the region. Recently, Saudi has mentioned that in the next 5 years it wants to have a completely nationalised healthcare industry where only Saudi nationals work in the industry. I mean, that is a pretty high target within 5 years to achieve that. But I wonder if we start with you, Mr. Moopen, about the seriousness of creating a local, domestic, educated and skilled marketplace for you to choose your staff.
No, the ideal situation will be to have people from that country working in the healthcare institutions there. That is the ideal situation, and I think that is prevalent only in very few countries if you look at in the Middle East. Maybe in Egypt you can get people who can work there, maybe in Jordan, but many other countries it's not available. So you have to import people and you have to, get a lot of people from outside. So way forward will be for the countries, for the governments, for the authorities to focus on getting their people, the locally available people trained. This is happening, especially at the higher level like doctors and all. But when you go to the lower level, in some countries at least, for example, you may not have nurses to that level that is required. So it's a long journey. See, the healthcare here has started maybe 50 years back. People used to go outside for everything, and slowly it is changing. Especially now what's happening is that the countries which used to send a lot of patients here, for example, my country, India, used to send a lot of doctors, nurses and all. Philippines used to send a lot of nurses here. Now what's happening is that those countries, the opportunities are going up. So you don't get as easily as earlier people coming here because the difference in salaries, tariffs and all are not that much. People have opportunities there.
One of the big issues facing this region are the lifestyle diseases. I mean, just some statistics out of the UAE, cardiovascular disease is killing nearly 1 in 3 people in the region, and we've got diabetes. 1 in 4, 1 in 5 people have diabetes. What can the healthcare sector and the industry do to really address this issue?
So the important thing is awareness. From the media, very important, because public awareness, media plays a major role, as well as from the healthcare providers and from the authorities. And even going to a level of some sort of a statutory regulations where children, for example, are prevented from having access to, habits forming like, for example, fizzy drinks and such matters. I have a feeling that we have to tax very heavily all these things like high-calorie drinks or if you look at smoking, heavy tax, and that money can be used for promotion or for the awareness building against such diseases.
Well, let's just finish up by getting your thoughts on the future. What is the future going to look like in this region as far as the healthcare industry goes? I wondered, Mr. Ahmed, if we could start with you.
I think what you will see is a continuation of the growth of the healthcare sector, whether it's hospitals or diagnostics or pharmaceuticals, etc. Historically, it's been between 10 and 15%, and you'll see that continue by virtue of it's coming from a low base relative to other markets. We're very bullish on the healthcare segment as a whole in MENA. Now, could you get a regulatory curveball which will then make us less bullish? I think in the markets which we already operate in, less likely, because we've kind of understood the current framework, and we think generally these are progressive governments overall, because I think what's beyond the doubt is that everybody understands the complexity and the issues that these governments will be facing in terms of healthcare in the future.
Aziz?
Look, I think I agree. Healthcare will remain a big sector for the future. I do see that the private sector will be more involved for a simple reason. Governments have come, from my perspective, almost to the end of the line as to what they can afford. And there is a big push, if you look at Kuwait, if you look at Saudi, just as 2 examples, where that cost for government has to go down. In addition to that, there's a price to pay in this Arab Spring environment by governments to make sure that their people are happy, and that price has gone up in the last 2 years. And part of that is also the quality of healthcare and the ease of getting healthcare and accessibility of healthcare. And so far, I think governments will be moving ahead forward to share that burden more with the private sector, which means also clear opportunity for the private sector.
Dr. Moopen.
You have to have modern facilities, much more tertiary and quaternary care to be brought in here, because even now people have to travel outside for some of the treatments. So for which there has to be a planned activity, this has to be centralized, not that this has to go into all the countries. And you will have to have accessibility to that, for which there is resource available. There are people who are ready to do that. Only thing is that that environment has to be made. And I see that happening, especially in Dubai, for example. There's a great vision like making the healthcare city. The healthcare city, if it comes up, will become a hub where people from all around the world I mean all around the region, this 1 billion population from the Middle East can access that, and they need not go out of this place for getting the best available treatment. So I see that happening, if not today, tomorrow, if not in 5 years, 10 years, it's going to happen.
Dr. Azad, Moopen, Ahmed, Badreldin and Aziz Al-Yaqout speaking to me earlier. Well, that's almost it for us this week, but before we go, let's take a quick look at how